Let's start with our first section of medical complications of pregnancy. And in this section, we will discuss some respiratory diseases that can affect the pregnancy. And the respiratory diseases we will specifically talk about in this section will be pneumonia. What are some warning signs of pneumonia that can make the patient alert that she might getting pneumonia? And then what are the effects of asthma, and then also cystic fibrosis during pregnancy. Here in this diagram, when it's showing the normal chest structure, and then in the pregnant and in the non-pregnant, it's the comparison done. And then with the straight line, this is the pregnant women's presentation, and then the dotted line is the non-pregnant women presentation. So this here in this diagram, this area, this is the lungs, and this is the heart in the chest. So the lungs are little bigger. If you see, there is more bigger area covered by the lungs, and the heart is also enlarged also. And the diaphragm, this is the diaphragm. Diaphragm is the muscle that separates the chest and abdomen, and it's the major muscle of respiration or breathing. So diaphragm is also elevated in the pregnant female as compared to non-pregnant. All this is mainly because of the pressure of the growing uterus or big uterus on the structure that cause elevation of the diaphragm, and the also the enlargement of the little lungs and the heart also. So these are just the diagrammatic picture of how the respiratory system is different from in pregnant and non-pregnant women. Next, the pneumonia warning signs. Respiratory rate. The pneumonia warning signs is respiratory rate is usually more than 30 per minute. The normal respiratory rate in adults is about 14 to 20. So in this, it's and more than 30. That's the warning sign. So the tachypnea. Pnea is for the breathing. Tachypnea is the term used for fast breathing or rapid breathing, and bradypnea is the term used for low breathing count. So the breathing count is increased, or respiratory rate is increased, and it's even more than 30 per minute. Then hypoxemia. Emia is blood. Hypoxia is for the low level of oxygen in the blood. So hypoxemia, partial pressure of oxygen is less than 7.9 kilopascal on room air, which is the low oxygen in the blood. So hypoxemia, or partial pressure of oxygen, is less than 7.9 on room air. Acidosis is present, which is pH less than 7.3. The pH is the concentration of hydrogen ion. We have neutral pH, and then we have acidic pH and alkaline pH. Alkaline pH is high, acidic pH is to the lower side. So if the pH is less than 7.3, it's the acidic pH, or acidosis is present. Hypotension or low blood pressure is present also. DIC, or disseminated intravascular coagulation or clotting, is occur also present, disseminated. Elevated blood urea level is present. and there is evidence of multiple organ failure. All these are the pneumonia warning signs. There is organ failure, elevated urea, DIC, hypotension, acidosis, hypoxemia, and respiratory rate is increased. All these are the pneumonia warning signs. And patients should be really alarming if these signs are present. Next is the asthma. Asthma is an increasingly common disorder and can be expected to affect 5 to 10% of pregnant women. Asthma is a condition in which there is difficulty in breathing as a result of the narrowing of the bronchi and bronchioles. So patients have really, they are hard of, they cannot breathe easily. So there is difficulty in breathing, and it's coming very common in the pregnancy also. 5 to 10% of pregnant women, they are affected by the asthma. Implication. What are the implications of pregnancy on asthma? Not predictable. The implications of pregnancy on disease or on asthma are not predictable. Approximately 1/3 of women improve, 1/3 will get worse, and 1/3 stay same. So it's not predictable. Different cases, about 1/3 of the patient, they stay the same. 1/3 their condition is become worse with pregnancy, and then about 1/3 they get better also. Their asthma improves during pregnancy. 10% of women with asthma will have an acute exacerbation. So 10% of women who have asthma, they have acute exacerbation or acute attacks that occur during the pregnancy. Now, what are the effects of disease on pregnancy? If somebody has asthma and they get pregnant or she get pregnant, what are the effects of disease on their pregnancy? Well-controlled asthma usually have good outcome of pregnancy. So if asthma is under control, usually the outcome of the pregnancy is good. Poor control asthma, increased risk of growth restriction, premature birth, and preeclampsia. All these complications occur during pregnancy only if the condition is not under control. If patient is not being managed properly, then it can cause intrauterine growth restriction, preeclampsia, or preterm birth. All these can occur as a result of asthma. Features of severe life-threatening asthma during pregnancy or as in the normal individual also. Sometimes worsening of asthma or acute exacerbation of asthma occur, and severe condition of asthma known as status asthmaticus. Status asthmaticus is a condition in which the asthma becomes very severe, and usually patients have difficulty in breathing for a prolonged time, and remissions are not occurring. So severe asthma, peak expiratory flow rate is less than 35% of predicted. Partial pressure of oxygen is very low, it's less than 8 kilopascals. Partial pressure of carbon dioxide is increasing, it's 4.6, more than 4.6. So all these are occurring because of poor breathing. If patient is not breathing not good, the oxygen levels get very low, and then the carbon dioxide start getting higher, and patient gets worse and worse, leading to very bad ventilation perfusion condition or ventilation perfusion ratio. Silent chest. Again, as no breathing is occurring, the chest is silent. Cyanosis. Cyanosis is the discoloration of the skin in which the skin becomes bluish in color as a result of poor supply of oxygen. This is the diagram that's showing how different factors, exposure to maternal diet and microbial exposure during pregnancy can depicts if how sensitive the child will be to different allergic diseases, and asthma is one of the allergic diseases that can occur as a result of different allergies to the newborn. So we have microbial exposure, then T-cell induction and maturation of innate immune responses occur, and all these different factors can give rise to how sensitive the newborn baby will be to the allergic diseases. Bradycardia is another condition that can occur as a feature of life-threatening asthma. Arrhythmia is irregular heart rhythm occur as a result of life-threatening, and this severe life-threatening asthma is status asthmaticus is very bad condition. Usually the recovery is not very good and prognosis is very poor. Hypotension, again with severe life-threatening asthma. Exhaustion, because of that breathing pressure, patient is very exhausted and nervous. Confusion is also present. Then management of asthma in pregnancy, usually the care should be improved, since I mentioned that not properly managed asthma or not properly treated asthma can lead to different complications like intrauterine growth restriction, preterm deliveries, and although preeclampsia also. So proper management or improved asthma care is required during pregnancy. Encourage smoking cessation. If a female is smoking, then they should be encouraged to quit smoking. Patient education is required. Optimal control and response to therapy should be properly managed if the therapy is helping or the mother or the not. Manage exacerbation aggressively. Any acute exacerbation should be aggressively managed because of their very serious nature and their effects on pregnancy. Avoid delays in treatment and manage acute attacks. Multidisciplinary team approach is important since it's pregnancy. It's important that the obstetricians and the medical specialists and the pulmonologist, all these different multidisciplinary teams should be working and functioning together so to avoid any complications that can occur during the pregnancy. Then the other condition or respiratory disease that I want to discuss here is cystic fibrosis. Cystic fibrosis, this is the diagram. This is the normal healthy airway, and you can see the flow of the air that's occurring through the normal healthy airway. And this is the airway with cystic fibrosis. The airflow is decreased because of the presence of the fibrosis. Incidence of cystic fibrosis is 0.05 to 0.1% of births in Caucasian population, in which 5% of adults carry recessive genes. Women with cystic fibrosis account for 0.4 to 0.8% of pregnancies in US and UK. Up to 80% of females with cystic fibrosis, they end up having a live birth and live child. So the incidence or the outcome of pregnancy with cystic fibrosis is good. Cystic fibrosis, again, you can see the diagram with cystic fibrosis. Lungs are all fibrosed and shrunken. Implications of pregnancy on disease. Pregnancy tolerated well. Risk of pregnancy relate to degree of pulmonary dysfunction, poor lung function, irreversible decline in pregnancy. So it's well tolerated, but again the outcome of pregnancy will depend on how bad is the condition. If the condition is not as bad, the outcome will be good. If the condition is bad, then the outcome is not very good, and irreversible decline in pregnancy can occur. Implications of disease on pregnancy. There is risk of transmission of disease to infants, increased risk of gestational diabetes. 1/3 of babies born are preterm, and growth restriction with poor nutritional status. So all these can occur during pregnancy. Growth restriction, it can be transmitted to the newborn, and gestational diabetes is also common in females who have cystic fibrosis during pregnancy. The management is planned pregnancy and pre-pregnancy advice sought. Genetic counseling is important because it can be transferred to the infant. Optimization of treatment of lung and gastrointestinal function should be done. Assessment for pulmonary hypertension. High dose folate, about 5 milligram per day, are recommended during the pregnancy. Multidisciplinary care, again, as it's a medical condition, anything like this during pregnancy should be properly managed by different fields, and it should be multidisciplinary care. Pulmonary function tests are important to perform because of severeness. If the pulmonary function tests are affected, if there is seriousness of the condition and breathing is affected, then all the complications which we talked about, asthma, they can also occur in patients with the cystic fibrosis. So it's very important that a very close look should be, close eye should be kept on the pulmonary function test. And nutritional support is important. Patients should have enough nutrition, good diet, so they can be properly managed. So that was all about the respiratory diseases that can complicate the pregnancy. Thank you for watching sqadia.com.